Hi, I'm Kathy Bile with Kids First Battlefords.
Hi, my name's Angela Bowen. I'm with the College of Nursing at the University of Saskatchewan.
I'm Colleen Sabra, and I'm the Executive Director with the Battlefords Early Childhood Intervention Program.
We're here to talk about the Maternal Mental Health Community Care Guide that was developed through Kids First and the Maternal Mental Health Committee in Prairie North Health Region. And the toolkit is designed for use with maternal women, pregnant and postpartum women in your community. For those of you in the province who've used the care guide that we developed, this is a community version of it, so that it's designed for workers in the field, nurses and support workers, outreach workers. And it goes through the scoring of the Edinburgh Postnatal Depression Scale, which is on the back, the scores that you might get, and those resources within the toolkit that the workers may reach for to help them. It also has this additional one, has what to do if there's a positive score, to number 10, which is self-harm, if you're concerned about what you might do with it.
As Angela showed this sheet, Community Care Toolkit, it talks about each of the handouts that are included, and I'll just go through those with you. Anxiety and worry, breastfeeding and mood, boundaries, depression, emotions, exercise, family and friends, food and mood, loss and grief, rest and sleep, self-care, stress busters, and treatment. So those are the pieces that are in all the community care toolkits, with an individual page that reflects each topic. So for Kids First, we have included a little bit of a different cover. Ours has our logo on it, and we have also put in the sheet that has corresponding Growing Great Kids and Growing Great Families curriculum, so that each Kids First site can utilize curriculum as an additional resource. So what we've done with families is the home visiting staff have this kit with them, and so when they go and see a family and a family indicates that they have stress issues and they are scoring on the EPDS, then the home visitor has a resource available to them that opens a conversation with the family, because some of those items are quite difficult to talk about, or at least to open the conversation. So one of the ways that they do that is either just using the handout, and you can expect that each handout will take approximately half an hour to go through with the family. And the other way that they use it is through the use of props. And Colleen has put together a demonstration package for some of the props that correspond with each handout sheet. So Colleen, would you like to explain those?
Sure. As early interventionists, we decided it would be nice to have a kit. We're working with families, many families that live quite rural, and decided that if we had a kit that would actually take along with us, that would make it much more easier. The charts, the EPDS score, and each one of the pages are in here. There's a number of copies, so easy resource, and then they develop these. So this little box has anxiety and worry. So things like money, bills that we can't pay, our children that we have to balance in our life, vehicle transportation, cell phones, and of course food. A big anxiety and worry. And many families will choose this little kit to talk about, and that we can move further on. The fences and it's okay to say no is all to do with boundaries and how we set boundaries for ourselves as women. There's a light bulb that talks a little bit about treatment and when treatment becomes essential. My frontline staff may not do the EPDS scoring, but talking about that still becomes essential, that families are aware of that. Breastfeeding and mood, an easy slide piece that talks about the vegetables that you're getting, the grains, whatever, in order to have feel good about yourself while you are breastfeeding, that you're getting enough nutrients. Self-care, There's a manicure set and nail polish, as well as a little bathtub and toothbrushes. If we do some self-care, we feel good about ourselves, get up, put some makeup on, get dressed for the day, we can feel really good. Getting enough rest and sleep is represented in a bed with a little pillow, making sure that they get lots of rest. Stress busters in a stress buster ball is what this one refers to. This is emotions that we may have, so easy that you can pull a sheet off and we can talk about emotions if that's something that the mums or families are feeling. Getting enough sunshine is represented by the sunflower in our kit. Exercise, this is a little magnet. A variety of magnets are used, and this just happens to be one that's in this kit, and to do with soccer this one is. Family and friends, and how we use this one is lots of times if moms are feeling down or low or their mood is down, you can look visually very quickly that there's not a lot of pictures that represent happy times. So being able to take a picture, coming back, printing it, and then giving it to them in the frame copy. More resources that are available to us. So it's an easy way to bring up conversation, having some tools or props right in front of you. I use these when I'm talking to single moms groups in rural areas, young moms that have gone back to school and have an opportunity to have discussion or any kind of drop-in programs. And so I've used it in a variety of ways, but they are taking this kit fairly regularly on home visits.
Thank you, Colleen.
You're welcome.
The Community Care Toolkit, the handouts, they're all available, as I said, on skmaternalmentalhealth.ca. You can print them off. We ask that you do not change them, as they are copyrighted to Kids First, but you're welcome to use them and we encourage you to. Thank you.